Now, the Deputy Minister of Health, Dr. Phaahla, is in Limpopo on an oversight visit to inspect construction sites of hospitals in the province. Dr. Phaahla and his team went to Siloam Hospital in Vhembe district today and will conclude the visit tomorrow to the Limpopo Academic Hospital in Polokwane. The Deputy Minister joins us now. DM, good to have you, and thank you very much for your time. Why those particular two infrastructure projects?
Well, thank you very much, Tabo, and good evening to the viewers of Newzroom Afrika. This is just a part of a broader oversight to look at areas where we have invested public funds in upgrading facilities, especially our hospitals. It's not going to end up here in Limpopo. I will be in a few weeks' time also in Mpumalanga and also in the Eastern Cape and also other provinces, for instance, also in the Free State. So essentially, what we have over some time now is that over and above the funds which are allocated from the National Treasury, what is called in technical terms, they are called equitable share. That is the budget which is allocated from the fiscus to all provinces, and provinces then allocate to various departments. On agreement, on our request over some years ago, we also have conditional grants, which are the monies which are allocated through the national department, and based on proposals from provinces, we are then able to earmark very strategic areas of investment. Right. And in this regard, we have been over some years now allocated funds for infrastructure, which come through the national department, and then based on business plans from provinces. So the projects which I'm visiting currently, starting with the Siloam Hospital, it's such a facility where over and above the funding from the provincial budget, this particular project, it's wholly funded through this kind of a national grant. So we have almost like direct responsibility to make sure that it is delivered. Similarly, also, the Limpopo Academic Hospital is one of such projects. Right. So primarily what I'm focusing on now is to make sure that where we have earmarked funding to upgrade infrastructure, to make sure that this key strategic assets can be ready for NHI, that we can actually be sure that we'll be able to deliver.
When it comes to service delivery infrastructure, two things that I quickly did, and as I was reading up on this particular project, that the Auditor General would have pointed out. One is delays in delivering these services or finishing these infrastructure projects. Two is cost overruns. Now, the Siloam Hospital in particular, I think, would have been launched in 2011. So it's almost 13 years later that it's still not finished. Yes, we had 2020, there was COVID. If we still discount that, if we count the time that it has taken to finish this project, is quite lengthy. And I'm sure it is costing government even more than what would have been initially planned for.
Well, I think it's when you say initiated, let me just clarify that a decision was taken in 2011 to say that this hospital is in a state where it needs to be totally rebuilt. That was when the decision was taken. And from then onwards, the planning had to be in terms of making sure that the necessary funding stream is identified, and then the kind of the technical planning for the project. But what I can assure you, and this was confirmed in my visit today, so we have taken too long in terms of from the decision making and actually starting the project. At the current moment, the project actually in terms of on the ground, appointing the contractor and starting to dig the foundations started 2 years ago. And it's earmarked to be finished by 2026. So a lot of time went in terms of confirming the funding stream and finalizing the plans. Now, in terms of construction, it's recognized that you would rather take more time in terms of making sure that when you do start, that project is properly planned, and also that you have the necessary funding.
Yeah.
And then you can avoid. So I can assure yourself and the public today that that project of Siloam is actually from implementation is running on course and even earmarked, even though I'm saying that it's earmarked to be finished by June 2026. But I've been assured today that actually before the end of 2025,
right,
it will be finished ahead of schedule in terms of starting construction, and it will be completed within the budget.
Sure.
So that's what we want to see with our projects.
So I'm sure you would know around the 15th of March, it was reflected or revealed at least that it was sitting, at 34% completion. Where is it sitting now?
Today, as we speak, it's sitting at 60%. It's sitting at 60%, and in fact, the issues which we had to look at is that it's moving a bit ahead of the financial flow. As you would know, that budgeting within government, even, for instance, this is a 1.7 billion project. You don't get that 1.7 billion upfront. It comes per financial year. So the thing which we are now discussing is how to bring forward the funding, because it's moving fairly quick, and it will be completed at least about 6 months ahead of schedule.
Now, one of the things that would have been raised around that project with the previous MEC, now the Premier, was the lack of the prioritization of locals in terms of awarding tenders and employment. And at some point, she had to come up and speak against the community that continued to disrupt the construction from continuing because of this particular issue. They say that there are supposed to be 1,200 laborers coming from the community, but they are never seen. Right, 2 building materials are supposed to be coming from the area. They think they don't see that, and these are part of the things that would have hampered progress.
Well, interestingly, those are also issues which we discussed quite intensely today. I was there not alone. I was also with the local councillors. The acting mayor was there and other councillors. I was also with the senior traditional leader of the area, Hosi Chibase, who is quite a very senior traditional leader in the area. They did actually reflect on the fact that, I also had to ask upfront, because I have been aware, as you would imagine, that at the time when the current Premier was the MEC who had to intervene, I was also part and parcel of the people who had to oversee that. And they assured me that there was some disturbance which they associated with some kind of, election kind of instigated activity by one of a local person who mobilized people who were not on the employment register, because there's a process with the social facilitator. We work through the local leadership, traditional and also council leadership. And there was some disturbance even early this year around March, but they assured me that all that has stopped now. Everything is stable. At the present moment, they actually assured me that they've even reached a figure of 1,400 now of people who have at one stage or another been a part and parcel of the employees of the project. But remember that a construction project runs in phases. So not all the 1,400, for instance, today, the contractor had taken a leave. There was no activity, but it does not mean that if there was activity, there would be 1,400 employees. So it's in terms of the various stages cumulatively. They assured me that up to 1,400, but also they gave me also an indication of the phases in which they also involved local SMMEs. various delivery of particular materials, issues like bricklaying, paving, supply of various materials. So it's an area which I did say at the end that we need to look at how much we can even improve.
Yeah.
But I can assure you that from the indication, as I'm saying also, that's why even the project is a bit ahead of schedule, because there's been stability and peace on the site.
No, so just to cue here, I mean, the Labour Department itself would have been conducting a lot of inspections at particular facilities, restaurants in particular, but even some construction sites. Now, one of the issues that would have also been highlighted by the predecessor in your position would have been the unhappiness around the involvement or the employment, especially of foreign nationals, even in low skills jobs or ordinary jobs like plastering and so on and so forth. What's the situation now with that number coming to about 1,400?
At this stage, just judging at, by the fair amount of stability and satisfaction from, the representatives of the community, one would therefore, without having got a breakdown of the nationality of the 1,400 people who have benefited from jobs in the project, one would therefore assume that those are not the issues. I think even when there were some disturbances, it was more about the extent of local employment. And maybe just to hasten also to say in that regard, as we know, as the Statistician General reports regularly about the rate of unemployment. So it's a huge problem. So even as a small project of that nature, it provides opportunities, and even when it's complete, there will be some permanent jobs increase as the hospital expands. There will be additional employment, but you need a much bigger scale of infrastructure and other programs, because otherwise, even this 1,400 is basically a drop in the ocean in terms of an area like that area of Njelele in the Thohoyandou area. Unemployment will probably, in the rural province region like that, you're probably sitting at about 40%. So it's a drop in the ocean, but it is a contribution. But one suggests that from the lack of that matter of dominance of foreign nationals, it does suggest that in that area, in that project, it is not an issue.
Now, in your own budget vote speech earlier in the year before the elections, you would have highlighted the whole notion of how to improve on service delivery times. How can they be shortened? It seems there's something that this particular project is doing that is leading to some kind of success. If you're saying they might even deliver now by 2025, what are we learning from that, and how is that going to be extended, I suppose, to other projects to prevent cost overruns?
I am also optimistic, as you mentioned, that tomorrow I will be visiting the site which I launched in July last year on Mandela Day, the Limpopo Academic Hospital. I'm hoping for similar good news. The key to improvement, one is to make sure that when the project starts, as I mentioned earlier, that the full preparation has been done, not just in terms of the technical preparation, financial preparation, but also social facilitation. By the time you hit the ground, you need to make sure that all those aspects are catered for, but also that you have a very capable project manager. And in this case, we seem to be doing fairly well. This particular two projects at this stage, the overall project manager is the Development Bank of Southern Africa. They are the people who are helping us in project management. But also your professional team, technical team, and also you have to make sure that your process of also selecting the implementer, the construction people, they must be capable. If all those can be ticked, and including managing promptly, having all your leaders, social political, traditional in the rural province like this, and the business, because I mean, for instance, when we launched this one of Limpopo Academic, when I was here last year, the business people, the local business forum was there, and we're very candid with them to say, look, we will work together. We can never claim that we're going to have opportunities for everyone. We try by all means to be open and fair, but we have to accept the fact that as work expands, more and more people will get opportunity. So at this stage, if all those aspects are well managed, it is possible, and we are hoping that these projects will show that indeed it's possible to deliver public infrastructure on budget and also deliver on time. We might be taking too long sometime on planning, because you have to make sure that when you start, everything is ready. But I'm quite hopeful that even this one and other projects which I'll be visiting over the next few months will be able to. But it's also oversight.
Yes.
That we don't wait until too long. So we get regular reports, but you also don't just depend on your paper report or word of mouth report, but also physical presence actually is also going to chase the implementers.
Over and above the infrastructure and the equipment, of course, the other factor that is key to determining quality care is the staffing. And it seems performance in that area is according to this report that I'm reading, is not doing well. There's a critical shortage of staff in public healthcare facilities across the country, and the budget cuts are seemingly not remedying the situation anytime soon. That's according to Dr. de Klape, who was looking at this particular issue. Now with this new facility, I mean, one would think that you're already starting to think about staffing it and making sure that all the critical skills are brought into that facility.
Well, definitely. When we plan expansion of facilities or new facilities, we do make sure also that part and parcel of that, it's a revision of the staff establishment. And if it's a new facility, we make sure that there's planning in terms of making sure that there's adequate resources, reserved for employment. Will not always be successful. We may have, made a provision, but of course, all this depends on the performance of our fiscus. And as you would know that over the last 10 years since 2008, since the financial crisis, our fiscus has not been performing. So that has been letting us down. But from time to time, when there's improvement, we are pleased to say that, as we, speak to our colleagues in the National Treasury from time to time, they do come on board. It's not enough. It's correct that, you would remember that early this year, we had to really, be very strong in appealing to our colleagues when there were a number of unemployed doctors who have just finished their community service. They did come on board. We managed to get some additional funding, not enough across, because it's not only doctors. Dr. Klape is correct.
Yes.
It's also various other health professionals who are even far lacking behind in terms of the allied health professions,
all right,
physiotherapists, yes, and other allied audiologists, dietitians, and so on. Right. So those are the areas also which we are focusing on.
Deputy Minister, we appreciate your time. Thanks so much for coming on. That is the Deputy Minister of Health, Dr. Joe Phaahla there. Right, what's making news tonight on In Focus when we continue next? Stay with us.